Mr. Chairman, members of the committee. Glad to be here today. I want to thank you for such a well-balanced hearing. I think this is an important policy issue. It's not going away. It's something our state's going to be dealing with for some time. And I really appreciate the balanced approach and the different speakers you've had. I would encourage you, as this issue moves forward, there's other people you need to hear from. You need to hear from our substance abuse treatment community because they're on the front lines dealing with folks with substance use disorders every day and have insights into this problem, into marijuana. Our prevention specialists, you heard Mickey talk about 23 of the 25 highest states for teen use are medical marijuana states. That's going to happen here. It's happened everywhere that's passed medical marijuana. Now, is that, there's risk and rewards to all medications, and clearly from Dr. Barnes's testimony, there is some medical benefit to marijuana. But like all medications, there are risks, and those risks have not been, in previous hearings that I've heard in front of the General Assembly, those risks have not been explored. We've only talked about the benefits. And although there are folks who will come testify about the positive experiences they have with marijuana, I can also fill the room with people who have had negative experiences with marijuana. Those folks need to be heard from as well. Our University of Kentucky Center for Drug and Alcohol Research is known nationally for their work on substance use disorders and research into drug addiction and alcoholism. I would encourage you to hear from them because they've done a number of studies on marijuana and its effect on the brain. So as this thing moves forward, I encourage you to hear from more folks. There are risks that we're going to have to consider. But if this moves forward, the National Federation of State Medical Boards recently came out with, for doctors recommending marijuana, their guidelines. And they were very, very good guidelines. I believe I provided that to staff. If not, I will. I would encourage you to take a look at those and think about those if drafting occurs utilizing these recommendations. Senator McGarvey talked about a strict definition of debilitating medical conditions, and I would certainly encourage that. The fact is, in most of the states that have tried to do the right thing and have a compassionate marijuana bill, they've still ended up with 18 to 34-year-old white males with obscure conditions being the majority of the cardholders. For physicians that are going to be recommending marijuana, they need some specialized training and a special license. We've seen this in Kentucky before. A very small number of physicians can cause a lot of problems. We've seen prescribers, they kind of chase the business model of the day. Although they're very small in number, they can cause a lot of problems. We certainly need an agency to regulate this that's familiar with regulations and familiar with how to regulate something. I don't think public health is necessarily the right place for that. And certainly we need law enforcement background checks on all the people that are involved. Ohio did something a few weeks ago that I think would be very important in a bill for Kentucky, and that is they're requiring their dispensers to report to their prescription monitoring program. Also, the physicians that are recommending marijuana are required to query their prescription monitoring program. A physician can't make a good clinical decision about whether or not to offer someone marijuana or recommend marijuana if they don't know what other controlled substances that individual has been prescribed in the past or maybe currently on. Finally, what a medical marijuana bill should not contain, I believe, is the ability for folks to grow their own medicine. We have a problem with drug diversion in this state as it is. We have a lot of folks that live at the poverty level or below. The temptations to grow your own and then sell what you don't need are going to be really great, and that's understandable. We don't need, if you talk to kids in Kentucky and say, is it easy to get marijuana? They'll certainly tell you it is. We don't need it to be any easier. And we don't need people growing it in their backyard where their neighbor's kid can come steal it out of the backyard. So those are some of my cautions moving forward. This is a big policy issue for states to decide what's medicine and what's not. And I know 25 of them have gone down that road, but I think requires a lot of careful deliberation.
Thank you for your testimony, and you're exactly right. This is a big thing, and that's exactly why we're here today, spending 2 hours on it during the interim. Are there any questions? I would like to remind the members that there's numerous groups that wanted to appear before us today, and because the agenda was so full, they could not do it. Many of those people have statements in your packet. I know the family physicians and the Kentucky Hospice Association, Brian Jones is here on the front row. Dr. Brian Jones, the director of St. Elizabeth Hospice in Northern Kentucky, and many other guests are with us today. And the sheriff of Daviess County. I really wish we could have had time to take your testimony because you're certainly, I feel, one of the experts on this. But I think we've had a really good hearing here today, and I appreciate the members' patience. And if there's nothing else to come before this committee, we stand adjourned. Committee adjourned. Thanks.
Yeah.